education system. And then what sort of data do you think would best suit those purposes? You know, whether you collect that data or not, what sort of data would be the most useful to you? And then third, what are the strengths and the weaknesses of your data collection system in meeting those needs? So again, what are the main reasons how you want to use the data? And then what kind of data would be most effective in meeting those needs? And then just give an evaluation of your own data system. What's your experience? What's good about it? And where would you like to improve it? Okay, so maybe we can start with Vietnam and then go to Fiji, and then we'll open it up for questions.
Thanks, Dan. So just a quick introduction of the Vietnam team. We have here 5 persons from Vietnam. And this is Minh from the Ministry of Labor, Invalids and Social Affairs. Professor Hai, who is the Dean of the Special Education Faculty of the Hanoi National University of Education. I'm Anh Lan from UNICEF in Vietnam. Next to me is Mr. Minh, who is the Mr. Hữu, who is the General Deputy Director of the Primary Education Department of the Ministry of Education and Training, and Lan Anh, who is the Director of the ACDC NGO, DPO working in Vietnam, who is very active. And concerning the 3 questions that have been raised by Dan, I just would like to give the floor first of all to Minh from Molisa to answer and share some of the feedback.
Thank you for the introduction, and I'm very pleased to be here to actually I have learned a lot, because you know that I come from the Ministries of Labor and Social Affairs. That's why in terms of inclusive education, I know nothing, and today I have learned a lot. As you know that in Vietnam, Molisa is the body assigned by the government to be collect the data on the people who are most vulnerable to benefit from the social policies. That's why the children with disability is also the target group under the supervision and management of Molisa. And as you know that in Vietnam, we also have another body who also in charge of data collection. That is the General Statistics Office, as Diane has mentioned, who has been main tasks are collecting the data for the government, including the children with disabilities. And as you know that they only use the surveys and the census, and you know when they use the surveys, they just take the sample of some provinces and they got like the percentage number of people and the children with disability, but they don't have specific information like where they are, who they are, and what kind of disabilities they belong to, and what kind of policies they are benefiting from. So in that area, the Ministries of Labor and Social Affairs are in charge. And to do that, we have a system of staff. We call it administrative system. It means that we have the system at the commune level. We have the commune staff in charge of social affairs. In the district level, we also have the official, and at the provincial and at the central level. So we have the system from the central to the local area, and who will be in charge of collecting all the data, the list of the people with disability, including the children with disabilities, in which we have their name, their age, their kind of disabilities, the causes of disabilities, and the needs these people as well. So based on that, we can provide them with the support from the central level to the local level. And as you know, that the purpose of data collection is, as I know, to serve three purposes. The first purpose is to monitor how about the trend, the level of people, and the number of people with disability from this year to other years, and what kind of policies they are benefiting. The other purpose is for identification or for targeting, because based on the data we collect, we can identify who they are, what kind of need they are, and what kind of policy are needed. And the last purpose of data collection is to issue the relevant policy. Because if we have the number of children with disability, based on that, we can provide it to the ministries of education, and we work with like the ministries of planning and investment and ministries of financing to have the relevant policy for this kind of people. For example, we have the number of children with physical disability. We can have the relevant like textbook and material and education infrastructure to how to fit them. So that is the purpose of data collections. And what are the best data collections in Vietnam now? As we work for the ministries and we only have the administrative system, so now we just based on that. But you know that for GSO, for the survey, they also have their own data set, and that can provide for general purposes. And for quantitative, qualitative data, we also have, but it serves different purposes of different agencies, like UNICEF, if they want to have some kind of data for their own analysis on children, so they have some kind of quantitative data. And how about strengths and weaknesses? I think like many of the country here, we also faces a lot of weaknesses. For example, now in Vietnam, we still don't have a comprehensive and adequate data for people with disabilities in particular, and also for the people with social beneficiary in general, because you know that different ministries, different agencies have different purposes. Like the ministries of labor, we just manage the list of people who are benefiting from social policy, and the ministries of education and training, they only in charge of the like student and pupil, and like the ministries of transportation, they only take care of the people with like traffic accident, and the ministries of health, they only take care of the patient. So we don't have like a comprehensive and interlinked system that can provide like the adequate system and use. So that is one of our biggest challenges, and how to coordinate this data into one system and how to share it with the different ministry and stakeholder is also a long story to go. That is something about Vietnam, and I think our colleagues can share.
You see, okay. Thank you so much. I would like to share something about data collections on persons with disabilities in Vietnam. As Mr. Minh mentioned, at the national level, we have a data of persons with disabilities, but it belongs to the Ministry of labor and social affairs. But you know that when you look at different sections of ministries in Vietnam, maybe the data is very different. These reasons, I think that we have some reason why we have different data with on the person with disabilities, because we use definitions of person with disabilities different. Because you know that with the Ministry of Social Affairs, they based on maybe mainly based on the capacities of working a person with disabilities. Ministries of the health, they based on how to find out the problems of the child, and then they give some treatment or rehabilitation or early intervention for the child with disabilities. But in education perspective, we base on the needs of the child in learning. Yeah, that's the main. That is the purpose of the collecting data is very different from different stakeholders, because we use definitions of the person with disabilities different. And you know that inclusive education mainly used for education, but for the health sections, yeah, they don't so much focus on inclusive education, just treatment and rehabilitation. And Ministry of Labor and Social Affairs focus on support social policies, provides money, provides equipment, and supports other things. So with the concepts of inclusive education in Vietnam may be different from sector to sector. And you know that, but otherwise, you know that in Vietnam, education perspective or other stakeholders, we try to do our best for person with disabilities. So I think Vietnam, person with disabilities in Vietnam now, they are getting better life, because we try our best to do our responsibility. But the weakness is the cooperation between different stakeholders in a whole, yeah, in the society. Yeah, the health different, the social workers different, education different. Maybe NGO is maybe it's a different purpose. So another thing is data collection is capacity of surveyor. Maybe we can do this very easily, but it's with about nearly 10 million person with disabilities. We cannot have enough human resources that they are qualified enough to use the tool, yeah, to identify this person with disability and this person without disabilities. It's the capacities of the human resources, yeah, to do the collection. Okay, there's so many.
I know we only have so much time, and I want to be able to have time for questions too. So maybe if we can turn over to Fiji now to talk about, answer those questions, and then we can open it up for everybody.
Okay. Yeah, thank you, Dan. Just it's a member team here from Fiji. Our third colleague, not sure he's on his way or will not turn up. We have Mr. Lee Tian Olivo, who's the Senior Education Officer for Inclusive Special Education, the Ministry of Education, and myself, Setari Madanwai, with the Pacific Disability Forum based in Fiji. I'll just talk very briefly around broad general data collection in Fiji, and Ms. Olivo will talk particularly about the Ministry of Education, the MS, that I think Dan alluded to in his presentation. Fiji, we had our census last year, and Fiji the Bureau of Stats did use the Washington short set of questions, the 6. Out of that, 13.7% a person with disabilities in the country. Why that happened? I think the desire by government to better serve address the needs of persons with disabilities, knowing how many numbers they need to deal with in terms of population, the advocacy on the part of organizations for and of persons with disabilities, advocating for better lives for persons with disabilities in the country. And I think also the general awareness and the growth of the use of a Washington short set of questions within the statistics officers in the Pacific, with of course the help of Government of Australia's DFAT, Department of Foreign Affairs and Trade, finding most of the countries in the Pacific have done their surveys, including the Washington short set. And I think the partnership in terms of the statisticians with stakeholders being part of the designing of the actual the questionnaire, that I think was a strength, at least last year before the census. There of course, like Vietnam, administrative data in other government ministries. And I think I think last year there was an increase in budget allocation. I think we could say that with the census data, it did have some positive benefits in terms of increased allocation by governments within its resources to persons with disabilities, and of course the introduction of social protection scheme last year. I'll turn to Ms. Nolivo to share to us the work of the MS.
Thank you very much. Just adding on to that, with the Ministry of Education in Fiji, we have this system called FAMIS, Fiji Education Management and Information System, which is housed under the Corporate Services Division and, of course, our IT section. However, every section within the ministry looks after its own data input, as well as monitoring, evaluation, so forth. What is the reason for collecting data in terms of disability? We did not have any data on students with special needs or students with disabilities in the mainstream schools. Our system had been in a special education system over the years from the 60s up to 2010, and then we developed an inclusive education policy. However, we did not have that data to proceed. Having said that, that is the reason why we thought it best to collect data. In doing so, what we were particularly looking at was the number, how many students with disabilities, if we are going to roll out inclusive education, how many students are we looking at, given that the number of students all over Fiji is about 15,000. It's a small country with less than a million population, and the geographical location of the country is scattered all over the maritime, urban and rural zones as well. So in saying that, we thought it best to have a FAMIS system that actually brings in the data, or this data is actually given in by our teachers that are serving in all the schools. And when I say all, it's starting from ECE, primary, secondary, and also those in TVET sections. We were actually looking at the disability types, the number of students with disabilities, the severity of the disability, the learning needs, and the support services in terms of access to quality education and also reasonable accommodations. That was some of the things that we actually wanted to capture in this data collection. So in doing so, this built-in system in FAMIS had a student's learning profile where the teachers had to factor in all the information based on the Washington group of questions, capturing all the information on disability for every particular child, provided if the child is suspected to have a learning disability or any type of disability in the school. The first point of entering information in the database is done by the class teachers. This is done in consultation with the parents. This consent form that is available, which is like in the system and downloaded for them to fill in, parents to give in their consent, and then the process of data collection goes on. After the data is collected, then it is verified. The first point of verification is done by the head teacher of the school. And when that is verified, the second point of verification is by the district education office. The third point of verification is the office of the special and inclusive education unit before the request for funding is forwarded to the director of finance, who then approves for funding according to the budget that we have in place. So that is something that we have actually done, and this was made possible through our partnership with our donor program, which is the Australian Aid program, which played a very important role in coming in to support us in terms of data collection for children with disabilities in the schools. And also, right now, as I said, the geographical location of our country is unique in its own nature. So we are actually able to collect data from all the schools in Fiji, primary schools, so to speak. Where we are at this point in time is the verification bit, whether the information given by the teachers or from the schools is true and correct. That is the level that we are at right now. So
actually, you're referring to the student record, but could you also tell them about the school record, that you collect information on the school environment too, right?
Yes. Yeah. Okay. That's the first part on FEMIS. The other part is on the school environment. That again is a built-in system, which is I talked about the first one, which is disability information that comes under my unit. The school environment comes under our assets and monitoring unit, which is a unit that looks after school buildings, infrastructures, school compounds, drainages, and so forth. So they have a module in FEMIS as well, where they also attend to this questionnaire on how accessible the school environment is, whether they have ramps to the gate, whether it's accessible to the classrooms, to the washrooms, whether the hand basins are at the right level for a student on wheelchairs. So this kind of information is factored into FEMIS by the head teacher and the school management of that particular school. So those are the systems we have in place in terms of data collection from the Fiji Ministry of Education.
Right. Okay, so now I'd like to open up for people in the room. Have any questions or comments they'd like to make?
Yes, Mr. Haga.
Thank you. I was just thinking about Kenya and the cultural influences, especially when it comes to self-disclosure of disability, because in Kenya, the general concept of disability is quite negative. And depending on the method you use, like was said, you'll find that many people will not want to disclose that they have a disability. So the method you use really might really determine the kind of data that you get. I was just wondering whether in any of the two countries, Vietnam or Fiji, that's a situation that they can also identify with. Thank you.
Anyone else? Maybe we can get like 3 or 4. Yeah, okay. Here and there.
Thank you again, Michael Kahiti from Kenya. On the issue of the teacher is the one who fills data in the system. It means it is an online platform. And have the teachers been sensitized on how now to distinguish the severity, the type of disabilities, for them to fill in the correct data? Thank you.
Actually, I had a very similar question about teachers and teacher training. Thank you. So if you could explain if teachers were trained on the Washington Group questions, and whether that was costly or not, and if there were any issues with this. And then my second question was on if you could explain a little bit more on what the information collected in FEMIS is going to be used for, what kind of analysis you have planned, and yeah, and the impact.
Okay, why don't we start with those three questions?
The first one on sensitivity of the data. We have similar situation in Fiji whereby parents do not want to give consent to disclose the impairment of their students, of the child. However, there are two parts to the student's learning profile, or the two parts to what we fill in. The first part is basically teacher observation, and the second part is medical diagnosis. So when we talk to the parents about filling in these two forms, if they do not give us consent, therefore we will not fill in part 2, which is the medical diagnosis. However, it does not deter us from observing the child and filling in the particulars accordingly. So we still proceed with filling in part 1, which is, again, as I said, based on observations of what a teacher sees in the classroom. The other bit on training, of course, we do, before we actually ask the teachers to fill out the form, we train them. The order of how we have gone about doing this was we had our consultant specialists. As I said, we were able to do this through our partner organizations. So there were 5 of us who were initially trained. And then the 5 of, after our training, the 5 of us had to train all the district education officers, because the district education officers were going to be the second point of verification in the process. So when the district education officers were trained, they then trained the head teachers of the schools. And then the training filtered down to the classroom teacher level, and that's where the process is started. And that is as far as training is concerned. For the analysis of the data, there's a lot of reports that we are required to submit in terms of evaluation and monitoring from the Ministry of Education. We had to report against our annual plans and corporate plans of the ministry. We had to report against the SDG goals. There were international requirements as well. So this data was really useful when we had to report against our deliverables.
So I add a little bit related about the sensitive data related about the children with disabilities. In my country, Vietnam, in the past, parents of children with disability, they don't want everybody recognize that child that with disability, especially in inclusive school. So that's why sometimes we have to raising awareness of the parent of children with disabilities through the DPO network. And the other side that we try to advocate the school teacher how they can talk with the parent of children with disability that children need special need in school. Last year we have the one small pilot project called that the inclusive education for children with disability in rural area. We have the baseline survey data. 50% of the parents say that no, their children not the disabilities, they are normal. But after that, we raised some question related about Washington Group, with the functioning. So they finally that we recognize that child with disabilities, and after that we take a kind of methods that we discussion and raising awareness of the parent of children with disability month by month, and finally that parent that cries with us and they said, oh, this is the important for me that my child needs special things. And they say that in the past they didn't think that the important. So that's why the data, if we collect in the right way, it's very important to support the children with disability to inclusive in school. Yeah.
Are there other questions or comments? Yes, in the back there.
Hi, I'm Patrick Collins from USAID. Thank you so much for this. I guess I'm wondering, with your experiences with both survey and administrative data, I'm thinking of the first slide on data where there's kind of a missing percentage that's still not captured of out-of-school youth, whether through household survey data. Hopefully you're catching more, but you're still going to miss those in your EMIS data. And I think you just addressed it a little bit, but any other kind of observations on how you can work to triangulate that gap to capture the missing students otherwise?
I think, why don't you go ahead with that? It seems like it's the only question right now.
It's true that we lack a lot of data. And I think, as I mentioned earlier, that in Vietnam, we do not yet have a comprehensive and accurate data on social protection in general and for children with disabilities in particular. I just give you the number because, as you know, that in the administrative data we collected annually for every 6 months, that we have 7.3 million people with disability out of 95 million people. So it is almost more than 8% of the population with disabilities. And now we only provided the benefit for 1.1 million people. That means that we only reach 28% of people with disabilities. The other 82% are not recognized, are not identified. Why? As our colleague has said, that we have the sensitivities of their parents who don't want to show their children that are disabled. And the other point, we find out that the incentive of the policy, because as you know that in Vietnam now, we only give the people with extreme severe and very severe and severe disability who can access to the policy. The other are not. So when we come to ask them, why should I show you that I am disabled? Because we get nothing.
I just add, so in the Vietnam National Disability Survey, they asked the child functioning module. So in October, they actually are going to have an estimate of the number of children with disabilities who are not in school. The key is that the survey and the EMIS should take the same approach, right? So like in Fiji, there's a very functional approach in the FEMIS, but their census used the Washington Group short set of questions, which we know works very well for the adults, but it tends to under-identify the number of children with developmental disabilities, which is one of the main reasons for the child functioning model. So if they use the census, to look at the children who are out of school compared with the children they identify in school. There's going to be a little bit of a problem there because they're not quite the same measure. Of course, it's a lot better than if the census had said, "Do you have a disability?" But the key is that you have the kind of survey they had in Vietnam and the kind of FEMIS they have in Fiji, and if they had both in the same country, you would really be able to triangulate it really well. So they should get together and. When you guys leave, they have to stay. So no. Other questions? We have like 2 minutes left, so we have time for like 1 or 2 more. Oh, please. Oh, I thought you were telling me how much time.
Well, 3 minutes. I actually also have a question. I used to teach in a special education classroom. I'm Tori McKillop, and right now I'm here at IIEP for this conference. And one thing that I feel like when we look at data and evidence, it's about training the teachers and making sure they can input. And then we look at a lot of times I feel that we also overlook looking at leadership and management within the schools and making sure that the headmasters or the principals have training or are references or are guides. And I was wondering if either of your systems collect data on that, because we collect data on what teachers have training, we collect data on the buildings, but are we also collecting data on the school leadership and what other human resources are available for the children with disabilities?
Well, I can say for Fiji, we, like I said earlier on, every section within a ministry has their own data to look after. So in terms of the training of teachers, we have a section under the professional development unit, and they sort of take into account or prepare a training for all teachers for that matter, regardless whether they are teacher or head teachers. So, and they keep a record of that through FEMIS as well. So say, example, you're a teacher and I want to check under FEMIS whether you have done any courses or training in special education. With a click of a button, I can get that.
In Vietnam's case, we don't have that kind of leadership and management indicators yet, even though that for it's true, as you said, for the teacher training or the modules or the materials and all those things, we do have data, but none of the data on the school head or the headmaster of the school. So no data yet. No data. Even in the IMIS or in the national survey.
In the teacher, so in the FEMIS, when you click the button and look at the teachers, have you got the same system for the administrators in the system? You know, the general staff in the Ministry of Education?
We have 2. One is FEMIS, which is for the schools, and for the administrators, we have FESA. That FESA actually tells us the qualification of teachers, the placement of teachers, the salary, and all other information about the teachers, whereas FEMIS is for the students, and it has certain access, authorized access only.
Okay, and for education, Ministry of Education officials, have you got the same sort of records for the officials? You know, the sort of undersecretaries and the administrators and the heads of divisions?
Yes, it is under FESA, which is the Fiji Education Staff and Management System.
Okay.
Yeah.
Good. Thanks.
We're out of time, so
Yes.
Thank you for coming, and thanks to all our panel members.
We have to go and do the same thing again.
Yes.
Right, but now I guess that's right.
So-
We're going over there, right?
Yes.
Okay.
The audience stays here.
Right, so-
It's the panelists who are moving.
Could each
So
of-
please take your name tags.
Yeah, I was about to say, yeah, you should take your name tag.
heated discussion, interesting discussion in the other room. And maybe the participants would also bring their attention to the stage. We have here colleagues from Ghana and Ethiopia. We had a very nice discussion. I'm going to change the question so that you have to bring new ideas on the stage. We will first introduce ourselves because our Ethiopian colleagues haven't had a opportunity to introduce themselves yet, and then we'll go into the questions. And I need to watch, or are you a timekeeper? Okay, that's good. Thank you. Okay, so we'll start from our colleagues here.
Thank you. My name is Abaina. I'm from Ethiopia, DPO representative.
Thank you. My name is Abeba, and you can call me Abe in short. I'm here representing the organization working on disability issue, and I'm a lecturer also in Addis Ababa University on part-time basis.
Hello, my name is Ernest Wesley Otu from the Ministry of Education in Ghana.
I'm Jalil Odum. I represent the DPOs in Ghana.
Rhoda Encho. I work with UNICEF Ghana.
Okay, so my name is Sai. I'm working as an education counselor at the Embassy of Finland in Addis Ababa. I have a background as an academic and teacher, and have been working on inclusive education since Salamanca World Conference. Don't remind me. So, we have been discussing about the enabling environment and the different aspects, laws and policies, data, leadership, and financing, and we started from laws and policies in the previous discussion, and but I'm going to change the question now for the panelists, just to get the new ideas and views. My question in brief would be, do we need a policy on inclusive education in the country, or do we need inclusive education policy? What are your views? Well, maybe we can start. Maybe we can start with you, Ghana.
My answer is yes. We do need a policy on inclusive education, on inclusive planning, because government exists for the people, and governments can only make a case when there are policies or laws that guide what they do. It becomes the point of reference and for posterity. So we do need to have policies that have been agreed by the people to guide. And in the case of inclusive education, we all agree that education is a right. So we all of us need to have a document that directs us and guides us on how to deliver education for every citizen within our countries. Yeah, thank you.
So supporting what Ernest said, it's basically trying to set the direction that a country is going in terms of inclusive education. So what it is that the government wants to do, who is involved, how it is doing it, with whom and everything. I think so it's very critical we have a policy direction.
And for me, the policy would even not be enough. it should come with a costed implementation plan as to how government will be able to implement it within a certain time frame and how sustainable that implementation is going to be. So all policies, I think, that should strongly come with a costed implementation plan to guide the implementation process.
So what do our Ethiopian colleagues think about it? In Ethiopia, there is no policy on inclusive education, but there is a strategy on inclusive education and the master plan. Abebe.
Yes, unfortunately, we do not have inclusive education policy, but we need, because of two reasons. The first one is policy is enabling environment. So without enabling environment, it is almost, it is not logical to think about the implementation process. Secondly, if there is inclusive policy, it avoids all preventive and confusing implementation instruments that we have in Ethiopia. Probably you may have also in your country. So I think inclusive education policy serves us as a Bible or Quran, so it is very important.
For me, yes, because the policy, without policy framework, we don't know where we are going to be. So the policy is very important, especially for inclusive education, to ensure inclusive education from the point of this view. Really, we need inclusive education policy. Because of this, we miss, before 1 year or something, there was just a small data that shows from the Minister of Labor and Social Affairs shows that around 0.4 children with disability, 0.4% who school age as going to school. So this we are almost not sending children with disability in total to school. So this, if we have a policy framework, we can push them and to ensure that.
And the Ministry of Education data in Ethiopia shows that I think 8.4% of children with disabilities are going to school. So there are different data on the matter, and this leads us to the issue of data. We have data. All the ministries are gathering data, also some data on disability and related issues. NGOs are gathering data. DPs are gathering data. International organizations are gathering data. So there is a lot of data. My question is, how can we better use the existing data, since generating new data always requires more resources? Can we start with Abebe? What kind of ideas you have on that?
You have put it very properly, really. If you give you one simple example, WaterAid Ethiopia did its data collection process. So according to the result of this data collection, 6% of the total population of Ethiopia live with various types of impairments. But in my opinion, since the estimation is scientifically conducted, I really accept the joint global estimation data of WHO and World Bank of 2011. The other thing that convinced me is that Ethiopia is a country that which is considered as the architect of the war for the last 50 or 60 years. Short of days, disability is another, bitter result of the war. And we had also experienced drought and other, bad experiences. All these are the causes of disability. And the other rapid assessment that I have learned is that almost 90% of the cause of impairment in Ethiopia is either preventable or curable. So we are found in the meningitis belt area. By the way, meningitis is the cause for my visual impairment. So I think this is very important, but I have no option, except accepting, the WHO and World Bank joint global estimation.
Just the same. I agree with this point, but besides this, also we have to be work strongly with all partners to get central data as a country level from the government side, from the CSA. We realize we have a data problem as a country. This problem happened because of different awareness and other barriers. So we need to be minimize this part, to minimize this part, to work together and to get accurate data as a country. But for up to that, I agree with Dr. Ababa's idea that we have to work with international data, like WHO and World Bank says.
Okay, in Ghana, you have some experience of data generation and the use of data, but how can we better use the existing data from different sources? What are your experiences?
Well, the first I want to talk about is the methodology. It's very important. If I use a different methodology to collect data, for instance, on persons with disability, when you mentioned 8.4%, and I was whispering to my colleague, if I use glasses to enable me read, and your methodology elicits that if I use glasses, I'm a person with disability, and another methodology see it differently, you may report 40% as having visual impairment. Another methodology may say it's 3% based on what they calculate. So it's important to have a methodology that every institution that wants to undertake survey should comply with. Embedded in this is we need to have a nationally mandated institution that will produce demographic data. So any institution that wants to do some work should be able to work with them. That is important so that we have consistency in the use of methodology. Last thing that I want to talk about is the use of administrative data. It's very important. When it will allow us to have consistency and predictability in the data that is produced. Until then, we have been using surveys, and surveys are taken by different organizations. In Ghana in particular, we have one DPO who do a survey in a particular part of the country. Based on the prevalence rate, they will estimate that this is the percentage. Another DPO may do it in a different part of the country. Based on that prevailing prevalence rate, it may be different. All of them publish a report, it goes out, and then we read and then we get confused. We don't know which one to go for. But none of them is wrong, but it depends on the systems they use and at the times that they collect the information. So we need to emphasize on administrative data and then also have a nationally mandated institution to work with organizations that do work on demographics. That's what I think.
Yes, it usually is the purpose for which the data is collected and for who and about who. And I see when it comes to disability, a lot of times when they are even collecting data on persons with disability, they are looking at severe and profound, the ones that is easily recognizable. Of course, again, the cognitive and neurological and mental and intellectual disability may not even be recognized, especially if it's mild. So I think there needs to be some synchronization of what kind of tool or how data is collected. And I think importantly, the mandated institution should be empowered to, always be able to produce or, help in collecting some of this data. That's my opinion.
I also believe that in spite of the gaps that the ESA we did has helped us to identify, because if you use the inclusive education monitoring tool, which was designed together with the policy in collecting data on children with disability, we realized that the prevalence rate from KG to JHS was around 1.7%, whilst if you analyze the data from MS, you get about 0.4. So if you look at the gap, it tells us that yes, there is still more to do in terms of strengthening the analysis of data we collect on children with disability. But there is an opportunity window for us because moving forward, the Ministry of Education and the Ministry of Health are beginning to work together to institutionalize national screening right from zero till higher education level. And so once you are screened at birth, that data on you is kept in the system. It's an online computerized system which follows you right through your education till you get to the higher education level. And I think once we'll be able to do this successfully, it would also help us to improve the data we collect on children.
Okay, now we go to a new topic that we didn't discuss in the other room. We are going to discuss a little bit about the leadership and management. And I think we all have experiences that a good school leaders are a kind of prerequisite for good schools. One of the issues that I have been thinking a lot, looking at a huge country like Ethiopia, with a strong federal government, but also very strong regional governments. How can we, or I put it in this way, what would be an ideal leadership and management for inclusive education at different levels of the system? What are your experiences, good experiences that you can share, and what we might need to still improve? And maybe we can start this time from Ghana.
At the national level, we do have, we have structures from national to the community, or let me say district level. In terms of the national level, there's an implementation steering committee. After policy drafting, now we got to implement. And in implementation, we have the big national steering committee, and we have subcommittees focusing on different issues like sensitization and advocacy, monitoring and evaluation, capacity building, and then I think we have research, and there's one other thing. Yeah, and then there's also coordination and partnership, and also even fundraising committees. Basically, these subcommittees are supposed to make sure that in terms of all the components in the implementation plan happens. And so obviously these committees are going to help to make sure things happen at the national level. When you go to the district regional level, we also have several organs that are working together. We have the PTA, parent teacher associations, we have the SMCs, we have even district inclusive education teams, and some other organs that are basically helping to make sure it succeeds at every level. I think I'll let my
In addition to that, I think if we have all these fantastic committees in place, but we don't have the political commitment of the government in power to support with implementation, our work will be very difficult. One thing that at least we know for sure, this new government in place has part of their manifesto before coming into power that they will support the implementation of inclusive education. So there is that political will to support implementation of inclusive education. And that is what the National Steering Committee and the DPOs are leveraging on that platform or on that political commitment by government to seek to it that we have that leadership or we have that management supporting with implementation.
Ethiopia, how do you see it from your perspective? What is the kind of leadership that is needed at the different levels of the education system?
The problem is that Ethiopia doesn't have inclusive education policy. So this affects, the kind of the leadership that Ethiopia should have. Anyway, I will ask more about the experience of Ghana after this session. But in my opinion, I'm not opposing, the system of Ghana, the leadership system of Ghana. But what I know is that there is an old proverb which says that the camel is a horse designed by a committee. So I always fear, the achievement of the committee. Anyway, my recommendation regarding the Ethiopian situation is that the Ethiopian situation is very different because it is a federal system. So the ministry is mandated only to develop policy, legal, and implementation frameworks. But the implementation is given to regional governments. So what I recommend, already I have recommended always, is that the special units should be established at all levels of the education bureau, from regional, then zonal, warada, and school level. It must be a part of the structure of the government. But we have no, the guideline or the policy to do that. But this is my recommendation. But by now, there is a confusion. Some regional states have this special unit of the special needs education as a special unit. And the others also says, focal person. An individual will be assigned for one region. That person will be called as a focal person. So there is a confusion because of the absence of, inclusive education policy.
Maybe just to add something, as an Ethiopian DPO, we are observing like an Ethiopian education system as a ministry level. There is a special need education sector led by the directorate level. As Dr. Ababa said, at the federal level, they are working on creating policies and procedures, and they're drawing down to the regions. Then the implementation mandate is for the region by themselves, but still they are trying to involve as a public wing to discuss with the DPOs how to improve their processes. So still we are trying our best, but still there is a weakness. But there is a structure, there is a structure from up to down that the special need education system should be exist in Ethiopia, but it is still really weak.
Okay, thank you for the panels for your reflections. And now we have some time for questions and comments and clarifications. So there is one, and then Andres.
Hello, this is Rolando from UNICEF Kenya. I want to go back to laws and policies. And in Kenya, for instance, I attended 3 academic conferences. And the interesting thing is that in that three academic references, there was no mention of CRPD in the review of related literature of academicians. Another experience that we have is that we used to write a speech for a government official, and we highlighted CRPD as sort of legislation that supports inclusive education. But when the official delivered the speech, there was no mention of CRPD. So my assumption is there seems to be, maybe some people perceive CRPD as a Western concept, sort of. I'm feeling that there's no ownership with the sort of this very important piece of legislation. So I'm just wondering, in Ethiopia and Ghana, how do people feel about CRPD? Is it like, do you use this piece of legislation to advocate for inclusive education, or does it have the same perspective as from my experience as to how people see this very important piece of legislation? Thank you.
Another question. Can you wait a little bit? Get there?
Got it.
Thank you. Andre Vivier from UNICEF South Africa. I just want to make a comment and maybe play a little bit devil's advocate around policy and inclusive education or inclusion. Because I think in some way we put ourselves in a catch-22 when we talk about the policy and inclusion education, and it's not included already in existing policies, which actually should be the ideal and what we work for, because that should be the principle that cuts across all policies. Because then we will have that inclusion in our building environment policies, in our teaching and learning policies, and all of that. And I want to cite a very good lesson learned and example from South Africa is when we developed the integrated early childhood development policy. The original recommendation was that it must include children with disabilities, but a separate policy need to be developed around the inclusion of children with disabilities. And actually, the disability sector, the DPOs in particular, challenged the government on that and said that should not be like that, which happened at the end, that the whole policy includes children with disabilities throughout, whether it's about human resources, whether it's financial allocation and all of that. So my challenge, what I want to put forward, is a policy on inclusive education really the answer, or is the answer to make sure that inclusion is incorporated across all policies, and that one rather than work on a strategy to implement that? Because a policy at the end of the day is seldomly implemented if it is stand separate, because then separate budget allocations are needed and all of those.
That's a good comment for us to keep in mind. The question about the CPRD.
Yes, for us in Ghana, we love CRPD. Anytime we hear, yes, what happened in Ghana is that our Disability Act was adopted 5 months before the CRPD. So obviously there are some gaps. Like for instance, our emphasis even regarding education is on special education in our Disability Act. So DPOs are always talking more about CRPD than even our Disability Act, to the extent that right now the law is being amended. In fact, it's before Parliament now to be passed. So CRPD is really our Bible or Quran that we use all the time. We quote it everywhere.
Just a follow-up question. So how did you reach that stage where DPOs own the CRPD? And not only DPOs, but maybe some other people, because I appreciate sort of the appreciation of this important piece of legislation. So how did you reach that stage where you're using it and people own it sort of to start the agenda?
I think the conversation has, started with some of the projects or programs that we have been undertaking. Through the UN and then the Disability Rights Fund. There was always capacity building around CRPD at community, district, and national level. It continued for a while. So everywhere you go, everybody's talking about CRPD. And then later on, we realized that, there are gaps. It's not like they are all the same. And we're looking for inclusive education. So why don't we amend the law so that they all look the same? So immediately we have an amended law, we know we have a CRPD in our hands.
Thank you. CRPD, the same I share with Ghana, we love also. But the implementation of CRPD have a lot of barriers in our country because of existing laws. I think Ghana, luckily, they have the Inclusive Development Manual before CRPD, right?
The disability law.
Yeah, so that's really nice. But for us, there is a lot of barriers to implement CRPD, but still we're raising any issue on the disability concept. We are referring CRPD to defend the government also, to defend the other partners also. So CRPD is really our backbone to raise our issues still now in our country, and we are pushing to implement CRPD fully in our country.
Maybe I could just add on this discussion. Just half a year ago, the African Union adopted the protocol on the CRPD, which is a kind of, how to say, African adaptation of the CPRD. It's quite interesting. If you haven't read it yet, I would recommend that. There are some formulations which can be interpreted in such a way that that the kind of idea of inclusive education might be diluted, and I think it's very important for all of us who are advocating for inclusive education that we look at that protocol very carefully, and when the countries are signing and ratifying the protocol, that the issue of inclusive education is highlighted in such a way that there is no space for making interpretations that are kind of against inclusive education.
I'm sorry, just it is to share you the confusion, but I'm not a pessimist, by the way. The Ethiopian government endorsed or ratified the CRPD by the parliament. So according to our constitution, Article 9(4), any international agreement ratified by the parliament will be a part of the law of the land. So CRPD now is a part of the law of the land of the country by the proclamation number 676, 2010. But the problem is, it is my personal opinion, that our constitution treats the issue of disability as a charity, which is not compatible with the convention. So constitution is a supreme law. So in my opinion, practically, to tell you honestly, the convention doesn't work in the court. This is a problem. But we are very careful. We do not raise this issue. As I've told you, ignorance sometimes is important. Yeah. So I think this is a situation regarding CRPD in my country. You know, Finland didn't ratify, the convention as soon as the convention was developed. You know the reason? The country was reviewing her domestic laws, whether there is, the provisions that may not be compatible with the convention. This care was not done by the Ethiopian government. That's the problem.
Okay, there is still, I think, one or two brief questions or comments, and then we have to finish.
Hi, Katarzyna Kubacka from the Global Education Monitoring Report. Thank you very much for your inputs. It's very interesting. I was wondering to the extent to which currently in your countries teachers in mainstream schools are with you on board for inclusive education, and if that is the case, what has worked in kind of generating their support, or if it's not the case, perhaps you could share this kind of strategies to bring them on board. Thank you.
Sorry.
I just want to comment on the CRPD. I mean, three things that is for me important in this discussion. I think the first of all that we should be very, very careful not to use the CRPD in isolation from other conventions, because the Convention on the Rights of the Child and a couple of others also deal with children with disabilities and by interpretation with inclusion. And also, if we talk about Africa, the African Charter on the Rights and Welfare of the Child is actually quite explicit around these, so that we don't do it in isolation. The second thing is that we also should understand how international law works in different countries, because the fact that a country has ratified the convention does not necessarily automatically means that they need to abide by it. South Africa, as an example, our constitution says that international law should be used to interpret rights, not to be enforced per se. And I've completely forgot what the third one was. I gather that it was not important.
Real quick and then 2 minutes.
Very quick one to follow up the first question. So my name is Hanna Alasvuori and I work for Education Global Practice in the World Bank. I wanted to quickly ask from both contexts, what are the other professionals in different levels that help actually the teacher to achieve what inclusive setting requires? So just to emphasize the fact that if the teacher is alone, maybe it's not going to be always successful. So what are those professionals that you have and have been supportive in making inclusive education a reality in your contexts?
Let me respond to the initial question on the inclusive education policy should not be in isolation. In the case of Ghana, we've mentioned we had the implementation plan and then the policy. But the education strategic plan has 7 sections and 7 thematic areas. One of them is inclusive and special education. And that section helps absorb the implementation plan, costed plan into the main strategic plan. So as we implement the main strategic plan, the basis upon which we submit to finance for budgeting, we are implementing it. So we don't take an additional document to Ministry of Finance or to our partners. So with the ESP, we are moving towards that, yeah.
We have less than 1 minute less.
Okay, I wanted to respond to
very
the
briefly.
teachers one. As Natasha presented this morning, we have gaps at the system level in terms of teachers being abreast with knowledge and skills in supporting children with disability in the classroom. Apart from a few teachers who have been privileged to benefit from training, specific training on inclusive education, we still have a lot of teachers who have very limited knowledge on inclusive education. But fortunately for us as a country, 2 reforms are taking place now with respect to our curriculum at the pre-tertiary level and then at the tertiary level. So the curriculum is taken into place or making provision for inclusion. So at the pre-service level, you make sure that even before the teacher comes out to teach in the classroom, they have knowledge or they are abreast with inclusive education practices so that when they come to the classroom, they don't struggle with managing the kids. Again, at the pre-tertiary level, it's happening with the curriculum reform, with the basic schools. So this issue would be tackled at that level. And when they come to the classroom, it will be much easier for them.
Maybe I can respond in terms of Ethiopia. In Ethiopia, all teachers, the new teachers, have a component on inclusive education. It's a very brief component, more like an introduction. According to the EMIS data, about half of the teachers say that they have some knowledge about inclusive education. It is a good stats, but it's not enough, and it doesn't tell anything about their actual capacities on inclusive pedagogy. But it's a start in a country where there are more than 500,000 teachers, and thousands of new teachers every year are needed to cater for the increasing access. So thank you for our panelists. Thank you for the audience.
All right, everyone, that is the end of our first day. Today, we have, immediately following this, we have a picture downstairs in the garden. So if everyone could please collect their items, because we won't be coming back upstairs. So if you collect your items, if you had any extra cups, please throw them away on your way out or reuse them tomorrow.